Hello everyone, welcome back to Podcast on Wheelz episode number 69. As we said on today's episode, please sit back and enjoy the show. So, obviously, it is another podcast episode, which is great. We're doing really well at keeping up with this weekly schedule. Donnie is back on the podcast. William has been
taking over for a bit.
Yeah, for a few episodes, but that's fine. We have a few stuff to talk about, including the first topic about William is William got a new peg tube or just a new feeding tube extension or a feeding tube in general.
Yep. So I'm going to be talking for him. He got a feeding tube a couple of days ago in his belly, which is called a G button. I have this and I've been having this for a long time, for like 3 or 2 years, I don't know. But my husband recently got it because of his ALS progression. His head strength is 3, so it's obviously quite bad of a strength to swallow and speak and talk, and especially eat. And he hasn't been eating well recently. So we got him a feeding tube in his stomach. He is recovering well. He got a couple rough nights of sleep, and he just basically kept tossing and turning, but he's doing really good, and he's handling the blends well. But yeah, he got a certain type of feeding tube just in his belly, and he originally had a nasal feeding tube, which he always used since February of last year. So it's been a while with that one, but we have a G button in him to help with regular feeds and persistent feeds every single day.
And meds and things that he can't swallow.
Yep. That's my husband's feeding tube. Yep. He is doing well, and he's recovering good.
And then we have another topic, which is so much medical stuff. We couldn't really think about the topic today, so today's podcast is going to be kind of not going to have so many topics.
No.
So we do apologize, but we want to talk about the amount of fucking medical stuff we continue to have. So each month, my insurance sends me boxes and boxes of my medical supplies.
Yep.
And obviously, I have a crap ton of them. To name a few, I have gauze around my tracheostomy, and I get about 60. No, we get 60 or 30.
I think you get 30 because we change one.
I get 30 pieces of gauze per month, maybe even more, depending on, if something goes wrong with my trach. And then I get a few humidifier caps for my tracheostomy.
Yep.
And then I get 2 tracheostomy changes just in case if one fails. And then I get 20 colostomy bags, even though I really need 8 in a month. We really can never be too sure about that.
Yeah.
And then I get 1 G button because my gastric feeding tube gets changed every month.
Yep.
And then I get 30 nasal gastric tubes, because I have a nasal gastric tube, and I've been having it for I think almost 3 years or 3 years at this point. And I used to get 60 per month because I used to do it every night and day. But now, since my swallowing in my head's gotten a lot weaker, we only do 1 a day, and that's been my schedule for a few months now. So I get 30 tubes, and then I get a bunch of feeds. I get around I get 300 boxes of feed a month, because I go through 10 feed boxes a day, because I'm pretty giant and my body just needs that much formula since I'm not eating really much of anything. I get like 3 feeds, small baby feeds, per meal I eat, and I eat about 4 to 3 meals per day, and I get 3 feeds every 4 hours, and that only really goes on for about 12 hours. And then the first portion of the day is just water for me through my tube. So mainly I just get about like 9 to 10 feeds, because my overnight bag contains a large feed. So around 10. There's so much stuff. Like, we tallied it, and I get about 25 boxes of medical equipment a month.
Yeah.
I'd rather have that much. Like, I don't even know what else. There's like catheters, which are 240, because I go through about 8 every day. They probably do send me more, because I could go through more in a day, but on average they send me 240 and more catheters per month. And yeah, like, I have way I have many more medical stuff. That's like just the bare fucking minimum. Like for me to barely survive, I get ambu bags. I get nebulizer treatment. I get SMA medication.
We get a lot of stuff.
We get a lot of stuff. And I continue to have all that medical stuff. Like, it's it's actually less than I had back then, because I used to get 60 tubes per month, which I was already reduced 30 down. So technically what you're hearing
is less medical
it's less medical stuff that I used to have. Donnie can talk about his, but, Donnie gets a little bit different things than me.
I'm definitely luckier in the catheter aspect, because since getting my suprapubic, I change it every 2 weeks, and I change it twice in a month, and that has helped me since February. So like half a year ago I got my suprapubic, and that's been helping me and saving my tail for 6 months, because I pee 16, 15 times a day because of my bladder and my C1 quadriplegic injury. So before that, before February, I used thousands of catheters, and then my suprapubic has saved me over 2,000, if not close to 3,000 catheters within 6 months. So I'm very, very grateful for my suprapubic catheter. It's just made things a lot easier. So that number definitely went down
a lot.
And we, don't calculate it, but I get a lot of stuff. I get my enemas and enema solutions, and I get humidifier caps and speaking valves for my tracheostomy, and new tracheostomies, and like Chuck's pads and suction tubes and medications and halo. I get a lot of stuff, and my husband adding to that probably puts us over 1,000 medical stuff in a month. Like the quantity of stuff, not like each device. Like we have 1,000 different. Hell no.
No.
I mean,
just little bits.
We need like 240 enemas for this month. We need 2 tracheostomies. We need 300 catheters in a month for my husband. We need like 20 medications. We need it's quantity of stuff. So we have probably over 1,000 quantities of stuff. It's not different stuff. We maybe only have like a handful of different stuff that actually I'm so sorry, I'm getting notifications, but we just get a handful of stuff every month, and really only 20 or 30 of those items are different things instead of but the quantities of them is 1,000 or more each month, and we hadn't even calculated each one. So we have a lot of medical stuff that we use, and we're very grateful to use it, because it's saving our life and making us feel a little bit better as we progress.
And I must say that they said enemas in that conversation. I used to have more medical supplies due to my enemas. I used 8 every single day. And so that had been several months. Like, I don't even want to know how many, but the important thing is there was several a month. Mm-hmm. But now that I have a colostomy and I can't really put anything up my butthole anymore, since
she got Barbie butt surgery.
I no longer use enemas. They're kind of just in the bag. They don't do. I mean, my wife still uses them, obviously, because she's a quadriplegic and she doesn't have a colostomy. But since I got my colostomy, I really only use like 8 to 9 really things a month. Bags, but I use more stoma paste and supplies. It can be more heavy on the supplies, but then again,
way less heavy on the enemas that go up.
Yep, and Matthew just finds it way easier to do that way instead of just putting enema up, because
and wait forever.
Yeah, because I used to spend 21 hours a week on the toilet, which is so fun.
I spend in my preference, my bowel routines, I do 2 a day, and they last 10 minutes to get everything going and out, and then we clean up. Probably a 15-20 minute process total. So that comes up to 3 hours on the toilet, if not maybe 4 hours on the toilet each week. 21 hours is crazy.
God.
And I
almost spent a day.
I go to the bathroom twice a day. My bowel routines, I just get 2 enemas and the solution up my, and I use 4 enemas a day and 2 solutions, so to get my bowels running and empty, so I don't have any accidents or bowel issues, because I have enteroparesis, so it's chronic constipation. So if I don't eat fibrous foods or not fiber, anything to get my bowels running, I'll get constipated quite easily.
Yep.
So I have to make sure things are in check and fully empty before I even start moving my day, because that constipation can kick me in my ass, and I would have to go to the hospital. So it's not fun.
No.
Or maybe not the hospital. I need to get drastic measures. I remember sticking up enemas up my butt when I was 7. That was very pleasant. No, I'm joking. That was horrible. It felt so weird.
Yeah.
But now I can't feel it, so that's good.
Which is good. But we just, in return, we do have a lot of medical stuff, and it's going to continue to probably get even bigger.
Oh, yeah.
Probably, or just might stay the same, because right now I'm in a place where everything's kind of staying the same and, kind of being delivered just like normal, like nothing's been added.
Yep.
Besides ventilator supplies in December, I used to not get those. Used to get trach supplies, just not ventilator supplies, like vent tubing and things.
My husband, we have ventilator supplies because my husband's on a ventilator, and I have a non-invasive ventilator in my bedroom. And I have a tracheostomy, so I don't have any ventilators attached to the tracheostomy, but I have the equipment because of my husband. So if I ever need a ventilator to my tracheostomy, I'm set, but I have a pacemaker, so my trach and pacemaker is just enough for my lungs.
But now with more medical, Sydney's hands have been acting weird lately, and Donnie can either explain it or Sydney can. So yeah,
I'll explain it. You heard about our medical mayhem in April, where me, my husband, and my wife have been having like tremors and weird swallowing issues, and overall feeling quite weaker than we regularly do. And my wife is physically able, so she's an able-bodied person, so she definitely felt these effects way more than me and my husband, to the point she was losing hours and hours of sleep at night because she physically couldn't sleep. And that kind of died down since June, so like 2 or 3 months ago it started dying down after appointments and blood tests, and they're like, yeah, I'll send her off to neurology. We don't even know if that appointment is even scheduled because neurology is expensive as hell. So we just went to a regular appointment for 7 blood tests. Like, one of them was a thyroid panel, one of them was to test like
rheumatoid to see if it was like anything
genetic or something. I don't remember.
Like a disease, autoimmune.
Yeah, autoimmune diseases and
Hashimoto's.
Yeah, or neurology as well. They all put all those components. Thankfully, everything came back normal. No red flag signs. That was good. But that also means whatever she's feeling is not those things.
Not one of them.
It's not thyroid. It's not like autoimmune diseases. It's not other things that could be going on. That's not the issue, which is kind of alarming if you think about it. Right? Yay, everything came back normal. Great. Why are we still feeling this way? Like, her twitches have definitely went down, and her symptoms definitely lightened up. Like, her twitching went down, but she still has it. The shaking or tremoring, she still kind of has it. She doesn't have every symptom, thankfully, anymore, but they're definitely still not out of the water. They're still kind of there, but way less progressive or worse. But recently, she has been having gripping issues with her hands. Weird. Especially this week, we've been noticing it. She tries to do tasks like get a dryer sheet, close the bread, pick up cups, plates, bowls, brushes, toothbrush. Every time she does any of those things, I'm watching with her because, she helps me do the assistant care as well. So I'm sitting there in the room with her, and all I keep seeing is her dropping stuff more than picking it up. I see her fumble it, have a hard time grasping it, dropping stuff, and you're like, yeah, that's just clumsy. Well, she's always been clumsy, so she knows her clumsiness on the back of her hand, but she's never that clumsy.
She's never really been that clumsy.
No, like, she's dropped drinks and brushes and bowls and dryer sheet, you name it. She's dropped so much stuff in this week, and but that's fine. Like, her hands don't feel weak, but whenever she's trying to grasp it, it's just she can't do it.
Yeah.
To the point they notice that it's that bad. So I'm like, okay, that's really weird. Her gripping has just been kind of awful. Her hands feel fine for the most part. They're just a little slow at grabbing stuff and not coordinated as well. And her walking is not nearly as noticeable as the hands anymore, but she still has that little like heavy limp thingy in her leggy, in her right leg.
But it's way less prominent.
Oh yeah, way less prominent, I guess. But she walks funny sometimes, and I'm like right behind her in the hall. And there was this one day, 1 week ago, 2 weeks ago, she was doing yard work out in the yard, and I'm assuming she overworked her body or something. And she was in the hall, and I was strolling right behind her, and all of a sudden I saw her like limp, like dead. Like her foot dropped and scraped the ground, and it looked like her leg was so heavy. I'm like, what the hell? Like, she acted like her leg was so heavy. I'm like, it's the same weight as your left one. So she's just been having gripping hand issues and a little bit of walking issues, but it doesn't seem progressive, which is a good thing, but
it's like it makes you worry.
Yeah, instead of the twitching, instead of the weird swallowing issues at night, instead of the weird odd speech, it's now progressing as movement.
That's fun.
Yep. So, we don't know what that is about, and we don't have any more appointments scheduled. God forbid I need any more. Like, we went to the doctor's appointment in June, the dentist appointment in August, another dentist appointment for a procedure in August, another one scheduled for August 25th, and then maybe our pediatrician. So I don't even know. We have this month alone, we have 3 appointments from the dang dentist. I do not want any more appointments, but the doctor referred us to neurology and said, yeah, it's definitely beneficial for you to send them to neurology, because if it's muscle weakness, twitching, and feeling or a sense of more odd movement, it's definitely time to send them up to neurology. So that's kind of worrisome. So we're just keeping it on the back burner, not trying to worry about it. And we've been doing really good, but it's just now amping up again.
The minute they stop thinking about it.
I know, it's so weird. Like, the doctor's appointment my wife was having muscle twitches, and she was like, look, it's happening right now. And then at the doctor's appointment, she had 20 arm muscle twitches, and I'm like, you can't tell me that's... I'm like, oh yeah, it's just anxiety. Okay, then I want to get that treated, because why the hell is it making her sick?
Manifesting all these fucking symptoms.
I know. And now it's hands and legs and stuff. I'm like, what the hell? Especially hands nowadays. But yeah, that's her weird, odd... hands and legs or whatever, acting funny recently, especially her hands this entire week. But yeah, that's basically my wife's little weakness thing and odd movements. She's fine, we don't feel weird or anything, we don't feel extra tired. It's kind of frustrating because she almost spills a drink. Now, spilling a drink isn't a big deal, but when it happens almost
time that day,
it's annoying. And yeah, and it's weird. So her movement is weird, and the symptoms have lightened up, but definitely not all of them are gone. We are not out of the woods yet, and we haven't been for 4 months. Anyway.
It's just anxiety, though.
Yeah, for 4 months.
What the hell? Anywho. But that the only time we weren't having those weird ass symptoms, our teeth decided you need 6 fillings. But yeah, if we're not having those weird symptoms that finally shut the fuck up after 7 straight weeks, we have more symptoms of another thing. God damn, we have multiple things manifesting at once that we don't even know about yet. Nope.
Which is kind of scary, but oh well. Anyway.
But anywho, that's gonna sorry for this
short ass episode. I'm so sorry.
Yeah, sorry for the short episode. We just didn't have a bunch to talk about recently.
Yeah.
So,
this week's kind of boring.
Yeah, this week was kind of boring. Nothing's really happening. But we do appreciate for y'all for sticking around for another Thursday, watching another podcast episode. So thank y'all so much for watching, and we'll see you next time. Bye.
Bye.